Edutainment Studios welcomes you to Parkinson's Disease, Understanding It. This module is part 2 of a 5-part series on Parkinson's disease. Parkinson's disease, or PD, can be challenging to live with due to the fact that it causes progressive changes to the body's motor function skills, as well as many other non-motor areas, which can include bouts of depression, sleeping problems, pain, and cognitive dysfunction. This disease greatly impacts the quality of life in both yourself as well as your caregiver. Although a lot of factors of Parkinson's disease are uncontrollable, actively pursuing all of the treatment options that are available can provide you with a sense of control and help you live your life to the fullest. In this course, the objective is to help you describe the possible symptoms of Parkinson's disease. Each individual person could have a variety of different signs and symptoms for PD. Early signs can be mild and may go unnoticed. Symptoms will often begin on one side of your body, then progress to the other side. Most of the time, the original side where the symptoms began will remain the worst. Some of the most common symptoms may include muscle rigidity or stiffness in the arms, legs, or neck when attempting to move them. You may experience resting tremors, which are involuntary movements or shakes from contracting muscles that are at rest. Bradykinesia is also very common, which is slowness in movement, even if you are trying to move swiftly. Postural instability is another classic symptom. With this manifestation, you will typically have poor posture and balance, therefore causing you to fall frequently. Muscle rigidity is felt as a stiffness or tightness in the arms, legs, neck, or trunk. It is not uncommon to be diagnosed and treated for arthritis prior to the diagnosis of Parkinson's disease. This symptom does respond well to anti-Parkinson's medications. Resting tremors are a characteristic that occurs while at rest rather than when the limb is being used. It will usually begin in one arm, but then it will spread to the other side. It sometimes even involves the legs, and on rare occasions, the jaw. The tremor is usually reduced or even stopped when the limb is being used in some sort of purposeful manner. This symptom responds fairly well to anti-Parkinson's medications. Bradykinesia, or the slowness of movement, can be very disabling and is one of the major symptoms for which treatment is sought out. It may impair your ability to perform tasks that involve the arms, such as writing, and the legs, like walking. The issue with handwriting may be one of the first signs you notice. This symptom responds well to anti-Parkinson's medications. Postural instability, or having walking and balance difficulties, is one of the first signs of Parkinson's disease. As the disease progresses, you may display difficulty in taking large steps, resulting in a shuffling movement. You may even have trouble stopping once you get moving. At this point, the use of assistive devices, such as canes and walkers, is recommended, along with physical therapy. Unfortunately, the balance problems do not respond well to anti-Parkinson's medications. The autonomic nervous system is what controls many of the automatic body functions. These functions include controlling your heart rate, blood pressure, sweating, and digestion. PD can often affect the autonomic system by causing constipation and urination control issues. Constipation is a common complaint, which tends to worsen with age. If you have Parkinson's disease, you may have a greater difficulty with it because the movement of food through the gastrointestinal or GI tract is slowed down. Natural methods, such as staying active, drinking plenty of fluids, and eating more fiber can be helpful. Failure to attend to these problems can lead to severe constipation, with the possibility of developing obstructions. You can also have difficulty urinating. This may include an urgency to urinate where there is little warning of the need to urinate. Because of your impaired mobility, you may not be able to make it to the bathroom in time. You may also have issues emptying your bladder completely. If incontinence is present, protective garments can be helpful. Depending on what the problem is, medications can also be helpful. Orthostatic hypotension is when your blood pressure drops when you stand up. This can result in lightheadedness and may lead to passing out or even falling down. Gravity causes blood to be pulled into the legs when standing up quickly, so compression stockings can be helpful to help with blood circulation. There are several medications that are used to treat this problem if the doctor agrees that it is safe to combine with the medications being taken for Parkinson's disease. Sex can prove to be more difficult if you have PD due to the difficulties you may be having with movement. Tremors tend to increase as your excitement level increases. In addition, some men may experience erectile dysfunction. There are also medicines that can be helpful in many of these cases. Check with your doctor if you are experiencing any of these difficulties. In some instances, you may develop an abnormal increase in your sexual drive or behaviors, which in turn can cause problems in your life and with others. This can be related to the anti-Parkinsonian medication and should be brought to your doctor's attention. Rather than an overproduction of saliva, excessive salivation or drooling is most likely the result of an accumulation of saliva in your mouth due to less frequent swallowing. Speech therapy may be helpful to encourage more frequent swallowing of the saliva. If the drooling becomes severe, atropine ophthalmic drops under the tongue may correct this problem. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 2 of Parkinson's disease, and please join us for Part 3.